Know that many women have ovarian cysts without even realizing it? In today's discussion, we will explore the nature of ovarian cysts, the common symptoms that may signal their presence, and the essential steps toward prevention and treatment. Ovarian cysts are fluid-filled sacs that develop on or within the ovaries and affect millions of women each year. Although many cysts are harmless and resolve on their own, others can cause discomfort and signal underlying health issues. By understanding the symptoms and taking proactive steps, you can safeguard your health and ensure timely care. Let us begin by defining what ovarian cysts are. These sacs are typically benign, yet their silent presence can mask changes within the body. Women may experience little to no symptoms until a cyst grows large enough to press on nearby organs. Common symptoms include pelvic pain, irregular menstrual cycles, and bloating. Some women report feelings of fullness in their abdomen, sometimes accompanied by pain during intercourse or even during bowel movements. Recognizing these signals early is paramount. Each symptom, though potentially subtle, serves as a reminder that our bodies communicate vital information when something is amiss. Imagine feeling sudden pelvic pain that disrupts your daily routine. Pain of this nature can vary in intensity, sometimes appearing as a dull ache and other times as a sharp stabbing sensation. These episodes might coincide with your menstrual cycle, making it challenging to discern whether the pain is normal or a sign of a cyst. The irregularity in menstrual cycles further complicates the picture, as it may be easy to dismiss the variations as routine fluctuations. However, changes in your cycle, when combined with other reported symptoms like bloating or discomfort during everyday activities, warrant a closer look. Remember, early detection can be a real game changer for your health. Now, let's address the feeling of bloating. Bloating related to ovarian cysts is often more pronounced than the bloating experienced from dietary causes. This type of bloating might be accompanied by a sensation of pressure or fullness in the lower abdomen. It can be uncomfortable and may interfere with daily activities, reducing quality of life. The gradual buildup of discomfort is a signal that should not be ignored. Knowledge about these symptoms arms you with the insight needed to seek help before a minor issue develops into a significant problem. Beyond the physical discomfort, ovarian cysts can also bring a sense of uncertainty and worry. It is natural to feel unsettled when experiencing unexplained pain or irregular cycles. However, it is important to approach this information with a clear and calm mind. When you observe symptoms, the best response is to consult with a healthcare provider who can offer a thorough evaluation. Regular pelvic examinations and imaging tests, such as ultrasounds, are instrumental in detecting ovarian cysts. These diagnostic tools help differentiate between benign cysts and those which might require further intervention. Your body sends clear messages, and listening to those cues is the first critical step toward maintenance of your well-being. It is in this context that preventive measures take on vital importance. Adopting a balanced lifestyle is one of the foremost strategies in mitigating the risk of ovarian cysts. A healthy diet, regular physical activity, and stress reduction techniques contribute significantly to overall reproductive health. In some cases, hormonal contraceptives are recommended by medical professionals to help regulate the menstrual cycle and reduce the likelihood of cyst formation. This regimen fosters an environment where your body operates more harmoniously, reducing the chances of cysts developing unchecked. Preventive care not only aids in dismissing the onset of symptoms, but also helps in managing the condition effectively if cysts do appear. Visualize a scenario where proactive checkups unveil any developing issues before they can cause significant discomfort. Regular consultations with your healthcare provider play an essential role in early detection. A prompt pelvic exam can uncover early-stage cysts, which may be monitored with a strategy known as watchful waiting. This approach is often recommended for smaller, asymptomatic cysts that do not immediately threaten health. It is important to understand that not all ovarian cysts require aggressive treatment. In many cases, simply keeping an eye on the cyst through regular follow-up visits is enough, as the body has a remarkable ability to heal itself over time. The conversation then naturally moves on to treatment options available once a cyst is detected and confirmed. Treatment strategies vary greatly depending on the cyst's size, type, and the severity of the symptoms. For smaller, less concerning cysts, watchful waiting may be the recommended path. During this period, your doctor might ask you to monitor your symptoms closely while scheduling follow-up appointments to track any changes. However, if a cyst grows larger or becomes symptomatic, more active intervention may be warranted. In such scenarios, treatment options can range from medication to manage pain and hormonal imbalances to surgical interventions where the cyst is removed. The choice of treatment is tailored to each individual, ensuring that care is both personalized and effective. It is important to note that surgical interventions, while sometimes necessary, are approached with careful consideration. For larger cysts, or cases where there is concern about malignancy, minimally invasive procedures can be employed to remove the cyst while preserving ovarian function. This is especially critical for women who are concerned about fertility. Advances in surgical techniques have significantly reduced the risks and recovery times associated with these procedures. Your healthcare provider will guide you through the decision-making process, weighing the potential benefits against the risks. Embracing informed discussion about treatment means taking an active role in your healthcare, a choice that can lead to better outcomes and greater personal empowerment. Throughout these discussions, maintaining a calm and informed outlook can also alleviate undue anxiety. Medical terminology and procedural details might sometimes seem overwhelming, but they are part of a broader narrative of proactive health management. Each diagnostic test and treatment option represents a step forward in the commitment to your health. A well-balanced lifestyle, combined with regular checkups and an open dialogue with your healthcare provider, creates a network of support aimed at early detection and effective management of ovarian cysts. Your journey in understanding these symptoms is not merely about managing a condition, but about embracing a lifestyle dedicated to long-term well-being. At times, the topic of ovarian cysts might evoke questions and concerns. You may wonder how common these cysts are and whether every irregular symptom indicates a serious problem. Research shows that ovarian cysts are relatively common, with many women experiencing them at some point in their lives. The key takeaway here is that while the presence of a cyst can be alarming, most cases resolve without intervention. Education on this topic empowers you with the knowledge to recognize symptoms without falling into unnecessary fear. Early, informed action is your strongest tool, and every small step, whether it is noticing a slight change in your cycle or experiencing a brief bout of discomfort, is an opportunity to reach out for professional advice. In our exploration of this topic, we have also examined the importance of lifestyle modifications. A balanced diet rich in fruits, vegetables, lean proteins, and whole grains is vital for maintaining hormonal balance and overall reproductive health. Regular exercise is another cornerstone of prevention. Physical activity not only promotes physical well-being, but also reduces stress, a significant factor that can exacerbate hormonal imbalances and contribute to cyst development. It is remarkable how small, deliberate changes in daily habits can lead to substantial improvements in health. An active lifestyle supports smoother bodily functions, helping to prevent the formation of problematic cysts and reducing the chances of severe symptoms when they do occur. As our discussion draws to a close, it is clear that awareness, education, and persistence are critical elements in managing ovarian cysts. The dialogue we have shared today is a reminder of the indispensable value of listening to your body. Daily signs, whether they are fluctuations in your menstrual cycle, sudden pelvic pain, or unexpected bloating, are important signals urging you to take notice and act accordingly. Each woman's health journey is unique, and understanding the specifics of ovarian cysts can help demystify the condition while providing clarity around potential treatment paths. Ultimately, our conversation today underscores a simple yet profound message. Early detection and proactive management are essential. Ignoring persistent symptoms can lead to complications, while timely consultation and treatment pave the way for effective care and improved quality of life. Ovarian cysts, when correctly understood and managed, need not be a source of anxiety, but rather a manageable aspect of women's health, navigable with the right information and support. Let us revisit our key points briefly. We began by exploring what ovarian cysts are and their varied manifestations within the body. We then examined the common symptoms, such as pelvic pain, irregular menstrual cycles, and bloating, which often serve as early warnings that should not be dismissed. By understanding these signs, you can take early action and avoid complications. Preventive strategies, including regular checkups, a balanced lifestyle, and even hormonal management, provide effective pathways for maintaining optimal reproductive health. Finally, we explored treatment options, ranging from active monitoring to surgical interventions, underscoring that the choice of care is always tailored to your unique needs and circumstances. In the realm of women's health, knowledge is power. Every step you take toward understanding and recognizing the signs of ovarian cysts is a step in the direction of healthier, more empowered living. Life is composed of ongoing choices, and one of the most important is the decision to listen to your body and respond with the care it deserves. As we conclude this educational journey, hold on to the message that you are not alone. Healthcare professionals are here to support you,